let's discuss an important aspect of men's health, the prostate. Did you know that it's a small gland that is responsible for fertility and also an overall well-being? It plays a big role in fertility. Yes. So join me as we discuss the ins and outs of prostate. My name is Isioma Jessica Odozi and you're welcome to my YouTube channel. If you're just joining me for the first time, do well to subscribe to my YouTube channel, click the like button and also the notification button so you always know whenever I upload a new video. You're welcome once again. So today we're going to be discussing the prostate health. So what is the prostate? The prostate is a small gland that is located in the male reproductive system and it is just below the bladder in front of the rectum. Yes. Now, what's the size of the prostate? The size of the prostate is about the size of a walnut. Yes. But as men tend to grow older, the prostate tends to grow larger. What's the major function of the prostate? The function of the prostate is that it adds fluids to the semen. That is the sperm. It adds fluids to the semen and it pushes the semen through the urethra. Yes. Now, what are the conditions that affect the prostate? One, we have prostatitis, and this is the inflammation of the prostate. It can either be acute bacterial prostatitis or chronic bacterial prostatitis. Now, two, we have prostate cancer. Prostate cancer is the second most common cancer that tends to affect males. And if not noticed on time, it can tend to lead to other problems like kidney failure, bladder stones, etc. Three is BPH, benign prostatic hyperplasia. Yes. And it is very common, but it isn't cancerous. Yes. This is the enlargement of the prostate. And when the prostate tends to enlarge, it causes blockage in the urethra, which tends to prevent outflow of urine. Now, what are the warning signs for prostate? 1. Frequent urination at night. 2. Frequent urge to urinate too. 3. Pain during urination or ejaculation. Yes. 4. Blood in urine. 5. Inability to start urination. That is, you're feeling pressed, but you get to the toilet, but you cannot pass urine. You can't just start it. That's 5. Inability to start urination. 6. Slowness or dribbling of urine. What I mean by slowness is that when you're passing out urine, it comes out slowly. And at the end of the day, you might not be able to completely empty your bladder. Or when you're emptying your bladder, you're passing out urine, it comes out, little comes out and then it stops. It comes out again and then it stops. Yes. So those are signs that requires for you to see a doctor, specifically a urologist. So it is very important that when you note any of this sign, please do well to go to your hospital or a nearby hospital and do well to ask for a urologist specifically. Now, how do you care for your prostate? 1. Eat healthy. When you eat healthy, you care for your overall well-being. So eat food like veggies, fruits, and proteins. It will help your prostate. 2. Get screening, prostate screening. It is very important. When you're approaching the age of 40 and above, please do well to go for screening. It is important. And when you have any family history of prostate or any prostate problems, do well to go for screening and go to a urologist, see a urologist, and to conduct the necessary tests and treatment that you need. 3 is exercise daily. When you exercise daily, it helps the muscles. And we humans, we hate anything that stresses us. But the least you can do is at least walking around. When you walk around, it helps the muscles. So please do well to walk around. As a man, please walk around. It is very important. Now, my last but not the least, quit tobacco. Very, very important. This serves as a risk for cancer. So please quit smoking and any tobacco at all. Even drinking, stop it. You know they go hand in hand. So stop it. So please quit all of that and you will help yourself a great deal. I hope you learned a lot from this video. And also, if you have any elderly at home, do well to listen to their problems, especially when it has to do with the male reproductive system, because people tend to, I've had a lot of patients that said, oh, they didn't know that this was what was wrong with them. They've gone to so many hospitals. If they had known, they would have asked for a urologist that they didn't know, and they'll be taking drugs and spending money. So please, whenever you notice any of the signs from them or they complain to you about this, do well to go to the hospital, and a urology hospital, or get to the hospital and after complaining to the doctor, request to see a urologist. It is very important that you do see a urologist. That is where you can really know what is wrong with you. I hope this video goes a long way. Do well to share my video. There might be someone out there. I know there's someone out there. So do well to share this video and subscribe to my channel and like my page. And if you have any questions, do well to leave them in the comment section. I will answer these questions. Till my next video, guys. I love you all. Kisses. Bye.